Hi everyone. Today we are going to see about the international patient safety goals on goal number 2, which is the effective communication, which is very essential in the patient bedside, whether it is a OPD or might be on the IB department. So how are we going to improve effective communication? So this starting from the verbal order between our healthcare workers. So verbal medication orders only for a specified situation to be used. Always the communication must be timely, accurate as well as complete. Avoid unambiguous and whichever it is understood, please receive that, and you can use the read back technique as well whenever a verbal order is given. The order received should be either written down, and read back policy is always to be applied, and clear instruction for post-discharge care promoting the patient positive outcome. Record in the patient that the name of the physician who have given the order as well as the nurse's name who have given the drug and the time, and it should be recorded in the closed brackets with VO, which is nothing but the verbal order. See that this is done always by a read back technique to avoid errors as well as to enhance the patient safety. Check the physician after the order has been given. The physician must be doing the countersign within the first 24 hours with the name, the title, and the page number. So coming to the written order on the other hand is also a sort of good communication, but see that the orders are very clear and it is being reported on the charts and the reports in detailed information. In non-verbal communication, maybe the healthcare worker is far away, just showing you one pill, two pill. Never go on with non-verbal communication. Always plan in for telephonic orders, such as whether the patient is receiving, what was the situation. So this may occur when the physician is not inside the hospital and he is elsewhere. Might be during the night care when we are giving the patient. Suddenly the patient had seizures or vomiters or cardiac arrest. In case of cardiac arrest, the resuscitation team will be enhancing all the therapy. But in case of sudden vomiting or any other pains, we have to get the order. So see that you give the situation of the patient in a detailed way. In order to carry out this, we can use the ISPA technique, that is identify yourself and the patient. You're going to explain through the phone who are you speaking and about the patient to whom you're speaking, what was the patient, which ward, what was the diagnosis of the patient who came in. Then you're going to analyze the situation. Like for example, the patient had sudden dyspnea. So what was the dyspneic problem? What was the respiratory rate? What was the BP? What was the previous drugs the patient has received? Whether any nebulization was given previously? All that you're going to give in the situation. And in background, you're going to give like whether the patient was planned for any other bronchoscopy today, or whether you are planning for any other deep problem of the patient can be given to the physician through the telephone. And then you do a deep assessment, such as you're telling the respiratory rate, use of accessory muscles, the SpO2 saturation, and so on. And finally, you are giving your suggestion, that is recommendation, like whether we can start with O2 or we can shift the patient to ICU and so on. So this is how we handle the patient by use your patient critical condition over the telephone to the physician by using the ISPA technique, which is identification, situation analysis, giving telling out the background, doing a detailed assessment of your patient, and you yourself recommend the possible solution to your patient. What are the challenges we may face during such handling of telephonic orders? Might be the language and cultural barriers, health literacy, time constraints, in case of an emergency department or surgeons, information overloaded. Just because I told you you do the ISBA technique, you should not give the detailed information starting from day 0. Might be the patient is on day 30 and you're going on giving a detailed explanation list. As well, interprofessional communication must, if it is like a fussy, that may also be a good challenge for us. So this is a small sample of ISPA tool communication. So in this, identify this is doctor and this is who is the patient and why are you calling about. And situation is that I'm calling because he is having some sort of respiratory issues, and you're giving all the respiratory rate status, saturation, the temperature, heart rate, BP, urinary output, and the level of consciousness. And also you're giving certain backgrounds, that is he is how many years old, for what he has been admitted, and was there any recent surgery, past medical surgery, currently what is the scenario being planned for the patient. An assessment, you think that this is a particular problem, might be the patient is on hypovolemia, you tell, or might be patient is having respiratory compromise, then the recommendation is that I would like to have come an interview, or you can tell that whether we can start on with some of the IV therapy in case of a hypovolemia. And that's all for today. Thank you for your patient listening. See that always we work towards patient safety. And if you have any doubts, don't forget to put it onto the comment section. And please do like and subscribe. Thank you all.